Hey everyone, so in the book in chapter 2 it talked about hypertrophy. I kind of went a little bit further and I did my research on left ventricular hypertrophy. So I have all my notes here for us. So left ventricular hypertrophy is going to be the thickening or enlargement of the heart's main pumping chamber, which is going to be the left ventricle. It develops due to chronic high blood pressure, aortic valve stenosis, which is when the aorta starts to thin out, hypertrophic cardiomyopathy, and then other heart conditions that cause the left ventricle to work harder. Although one of the biggest causes is going to be that chronic high blood pressure that you've had for years. Some people at risk are people with high blood pressure, people that smoke, women, and older adults are more at risk. It is diagnosed through a EKG, an echocardiogram, or an MRI. All three of those will kind of show them what's going on. Treatment can just be treating the underlying conditions that cause it. So if you have high blood pressure, your doctor might recommend that you have a more cardiac-friendly lifestyle. So that would include changing your diet to be healthier, getting more exercise, managing your stress, stopping smoking. Those would be some really big ones. Medications can be used. Some of these are angiotensin converting enzyme inhibitors, angiotensin II receptor blockers, calcium channel blockers, diuretics, and beta blockers. The calcium channel blockers, the diuretics, and beta blockers are pretty consistent with any other kind of heart disease and treatment that would be involved with that. Implications include heart failure. This is because of the reduced blood flow to the heart, and eventually after time, your heart doesn't have the ability to pump like it used to. Arrhythmias, so an irregular heartbeat or a fast heartbeat, atrial fibrillation, which is going to be a faster heartbeat. It can also lead to ischemic heart disease because of how long your heart can sometimes be going without oxygen or just not getting enough oxygen. And then it also puts the patient at a higher risk of stroke and sudden cardiac arrest.